Hello, everybody. My name is Natalie Yeadon. I'm the CEO and co-founder with Impetus Digital. At Impetus Digital, we have built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools. We have worked with life science companies from across the globe over the past 13 years to help them with everything from digital advisory boards, virtual medical education, online investigator meetings, and everything in between. And since the launch of our award-winning Insight Events platform, we've also been helping pharma companies with large corporate events, online education and meetings with their MSLs and sales, innovation hackathons, and all kinds of other creative virtual engagements. But more importantly at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious conversations with some of the leading edge thinkers, the digital provocateurs, the healthcare thought leaders, we can all work to collectively and positively disrupt healthcare. So I'm super excited to have one of these thought leaders at the table with me today. This is actually Dr. Harsh Vathsangam, and he is actually the co-founder and CEO for a company called Moving Analytics. This is actually a company that's dedicated to empowering individuals to develop healthy habits and live their lives free of cardiovascular disease. Their first product is a product called Move-In. It's a comprehensive, clinically validated cardiac rehabilitation solution that is used by several leading health plans, as well as services thousands of patients nationwide. Harsh's personal mission is to take technological solutions and apply them to benefit people's lives. He received his PhD in computer science from the University of Southern California, and he has vast experience working at the intersection of big data and mobile health. He is also one of the investors of iGuest. It's an alternative communication device for children with cerebral palsy, as well as a finalist at the Indian National Academy of Engineering, as well as a winner of the NASSCOM Award for Social Innovation. Welcome, Harsh. So happy to have you on the show today.
Thanks so much, Natalie. It's a pleasure to be on and excited to have this conversation as well.
Absolutely. I just want to say very exciting things. Can't wait to dig in about your company, Moving Analytics. But before we get there, I think a lot of people would be interested to find out how you made that really interesting transition from academics into a world of entrepreneurship. What was the motivation behind you making that move?
Yeah, that's a great question. And I do self-reflect on that quite a lot. For me, I think I had a really good academic career, initially as a PhD candidate and later on as a postdoc and working in private research as well. What made me want to transition to, I would say, the startup life was a couple of things. One is the visceral connection between what you create and the immediate impact it has on people's lives. And I felt, for me, academic life had a much more longer term, intangible impact, where the focus was more on discovery and advancing of human knowledge and less on practical applications that could immediately help everyone around us. So that was one reason. As opposed to why did I choose startups versus working in a bigger industrial organization, I think for me, it was, again, that time to impact. I didn't want to be weighed down by bureaucracy. I didn't want to be weighed down by multiple decision makers. I wanted to be jumping right in front of the customer's eyes and essentially working with them to craft solutions that could make their lives impactful immediately. So it was really that sense of immediacy that I felt propelled me into this arena.
Absolutely love it. And you got into something very, very useful and very important. So let's dig into a little bit around Moving Analytics. Yeah. So this is not something that's a second or a third or a tertiary company. This is something you just jumped into right away. Tell us a little bit about the discovery process and the problem statements that brought you to a place that said, I have a solution, there's a problem out there, and this is what the solution is. Tell us a little bit about the planning and the thinking that went into developing Moving Analytics.
100%. One of the things when we started Moving Analytics, we were very clear about is that this would have to be the kind of company that we'd want to work for. as founders. This is me and two other founders. Um, so what we wanted to do first is to not rely on technology as a means to solve a solution, but to instead start with solutions where technology could play a role, right? Like, and so start with the problem first and see how, if the right solution is you just mail stuff over in a low, so-called low-tech way, that's what it is, right? Um, and so essentially what we did was really talk to a number of members of the medical community. I think we interviewed well over 300 or 400 doctors and nurses for almost 2 years, really trying to understand what are the problems they face, what types of issues they would love to solve, and more importantly, pay to solve as well. And it was during one of those meetings that, specifically with the American Heart Association, that we first got introduced to this concept of cardiac rehab and its potential impact to society. The American Heart Association basically said, hey, we have this problem called rehab for patients after heart attack. We think that this is going to be a huge strategic priority for us, and we're willing to support solutions in this arena. And as we learned more about cardiac rehab, it was this case where the more you learn, the more you fall in love with the problem, because it's just such a beautiful problem to solve. Because number one, it impacts people's lives. It has a huge economic benefit. It has a huge user experience benefit. So it's kind of meeting all of those conditions. And we took another year to interview another 300 nurses who work in cardiac rehab to really try to educate ourselves about what is, in a very deep fashion, about what are the problems faced by cardiac rehab. And that led us to start the company after and get our first customer basically in 2016, after 4 years of research, basically.
Wow, good for you. That is
Yeah.
fantastic that you did that level of research to really dig in deep.
100%. I think it paid off a lot because it again gave us a very visceral understanding of the space, and was particularly important to us because as technologists, and I did my PhD in computer science, and this is our first company, we really needed to understand the medical industry and understand, in this case, this particular domain of medicine really well, so we could speak the language and ultimately take our flavor of the solution in this language as well.
So tell us a little bit about the 4 years of in-depth research with hundreds of healthcare providers.
Yeah.
What is cardiac rehabilitation? What brings somebody there, first of all? Mm-hmm. And then what were some of the issues that healthcare providers, payers, and patients were experiencing?
Sure, yeah. So there are about 3.5 million adults in the United States today that have what's called an acute coronary event, which means a coronary event that requires you to go to a hospital or an ER room and so on. So these include events like a heart attack, a heart surgery. Some people may be familiar with the term stent or PCIs, which are basically outpatient procedures where they clear blockages in your heart or replace certain arteries and so on. So all of these are diseases of what are called the coronary artery, which is the main artery that feeds blood and oxygen to all the muscles of your heart. When you have a heart attack, that artery basically bursts, which means your muscles start dying out and your heart dies. And that's what leads to your death as well. Now, once you are discharged from that event, cardiac rehab is a clinically supervised program that gets you to adopt healthy lifestyle habits in a very safe and sustained way so that you can improve your cardiovascular health and then reduce your risk of getting a second event. Cardiac rehab is a life-saving service because studies show that if you complete cardiac rehab, your chance of living another 5 years doubles. Your risk of getting a second heart attack or second heart event is cut in half. And think about it for those with pharmaceutical backgrounds. If you had a wonder drug that reduced future heart attacks in half, that would be the biggest blockbuster drug ever, right? Like in the market. And yet, despite these benefits, 90%, sometimes 95% of patients after an acute event do not participate in these programs. And the reason is purely one of access. To get access to a cardiac rehab program, you have to visit a facility. And for most people, they live too far from a facility, so they have to drive to long hours to get there. They take time off from work. They sometimes facilities they have a backlog of 3 months or longer. So you have to wait 3 months after a heart attack to get the benefits of it. And this is a problem for all the outcomes we mentioned. And that's what's put the spark in our minds, where essentially we said, hey, what if we completely alleviated distance as a problem here and made sure that you got rehab from your home where you wanted, when you wanted? What would that form of rehab look like? And that's what led us to create Move-In as a virtual rehab program that you can do completely from home.
So let's dig into this for a few minutes. Yeah. Let's actually define the typical physical cardiac rehab program. What happens if you were to physically go to a physician or nurse, and what happens and what's the duration and what are some of the activities?
Yeah.
And then from that, what did you glean from the physical attributes and translate it into a virtual experience?
Yeah, great question. So if you qualified for brick and mortar rehab or physical rehab, the current rehab experience, what would happen is you would have to come in for your initial intake appointment, where they will do a full rundown of your medical history. They'll do an interview of you to understand what you're willing to change. And then they'll create a customized treatment plan for you, right? This is assuming that you can get the first appointment in the first place, because often it takes 2 to 3 months to get that first appointment because of lack of space. And also sometimes you never get it because all the rehab facilities in your neighborhood or even in your county for that matter might be fully occupied. And this is a very common occurrence for people in this space. Now, once you get in, you have that, you essentially have to come in 3 times a week for a period of 12 weeks. So it's about 36 sessions that you'll do. Each session is an hour long, and it includes a combination of supervised exercise. It includes education about your risk factors, such as they'll teach you how to have a better diet. They'll teach you how to manage your meds and how to report your symptoms and so on. Between those 3 sessions per week, you essentially have no contact with your rehab facility unless you call them. So the rehab facility usually doesn't know what's happening. If you face symptoms, they don't necessarily have an insight into how you are recovering outside of the rehab program, right? So that's the other piece there. At the end of 12 weeks, if you last that long, essentially you are graduated and you go into what's called phase 3 rehab or a maintenance program. So that's what that experience looks like. So with us, what happens is if you qualify for the program, we reach out to you via telephone. And if you agree to participate in the program, we ship you a kit, which consists of a blood pressure cuff, weight scale, activity tracker, which is usually an Apple Watch or a Garmin tracker. And we also have a tech support person reach out to you to install the Move-In app on your phone. And the way we set it up is that essentially that whole kit automatically connects with your account in the app, so that it's almost a quick, within 15 minutes, you're set up with our system, basically. And then what happens is you're connected to a coach or a nurse, similar to you are connected in the brick and mortar case, but it's via telehealth. And the nurse, essentially what he or she does is conduct the same assessments at home by leveraging the kit that's given to you, and then also does a more in-depth at-home assessment. So they look at what your environment looks like. Is it easy for you or safe for you to walk at home or do exercises at home? Are there other risk factors in your home that we should be taking a look at? The reason why we do that is we understand that behavior change happens in the context of your day-to-day life. And those day-to-day life issues can be either accelerants or barriers to your change. So it's very important we understand how we do that to develop sustainable habits. So you're given a 12-week program. And as part of the 12-week program, you have weekly check-ins, which are 30 minutes long. And between those check-ins, you leverage the devices to monitor you while you exercise, and so those devices will track your minutes, your heart rate, your intensity, and then if there are any issues, they automatically alert the nurse and get back to you. So in that sense, it's basically you can exercise when you want, where you want. The coach is available for you to essentially continue to tweak your program, either progress you or address challenges, so that you continue to build habits in the context of your day-to-day life. And we've actually shown that it's much more sustainable to do it that way, because now you've built habits that are integrated into your daily life, as opposed to just coming to a facility, do your rehab, and then leave, and then not doing anything as part of that. So wow. That's what that experience contrast is, I would say.
Fantastic. So there's obviously some intrinsic advantage of doing the virtual telehealth version of the brick and mortar cardiac rehab program, mainly because you're accentuating or building or augmenting around the physicality of that person's environment, which you're not necessarily doing when people are physically leaving their environment to go to a hospital, because they can't replicate the barriers or the advantages of where they're living. So there's some intrinsic advantages. What have you noticed as being some of the key metrics of success or lack of success when comparing to the brick and mortar? What are some of the end of the day outcomes that people are seeing by using your program?
Sure. We've seen, so there are usually 4 or 5 major outcomes that people care about in cardiac rehab. So one is participation rates, because studies show that when you participate in rehab, all your clinical metrics and your life expectancy improves greatly. So that's the number one metric everyone tracks. In center-based rehab or facility-based rehab, that baseline number is a 16% participation rate and a 50% completion rate, right? So what we have shown with our virtual program is that it's a 70% participation rate, 70, and 80% completion rate. So when you look at the numbers, rather than 5 to 10% people completing, 60 to 70% of eligible patients complete these programs. And in fact, our data shows that the more a facility invests in virtual, the higher the participation rate it sees. It's almost like causation as opposed to correlation. So that's number one. We've shown through our program that of all the patients who are hypertensive, we are able to get at least a quarter of them to no longer be hypertensive. So which means their blood pressures are lower, they're normal, and they're able to manage their blood pressure. We are able to show that exercise capacity improves by 20% or 30%, which is in line with gold metric standards. And a very sobering metric for me is we were able to show that for those who had moderate to high depression in the program, 70% of them no longer had moderate to high depression at the end of the program. And particularly in today's world where basically the only way you can get rehab is at home, and loneliness and mental health can be an issue. I'm very proud of that particular statistic as well. And you can think of not only the impact to patient lives, but just the savings that health plans and providers would achieve by their patients being healthier and investing in a program like this.
So Harsh, this is fantastic metrics, and obviously gives us, pause for celebration. And that's obviously a great place. I'm just curious about moving analytics and specifically the Movin app. What is unique and different about this than hundreds of other physical apps? I'm thinking about, Noom as an example, as a weight loss app, and many, many others people use for diabetes and what have you. What is unique about the Movin app? And are you also device agnostic with the types of tools, or is there a very specific tool set that integrates with the Movin app?
Great question. So the way I like to think of it is that technology is, again, not the solution, but a means to achieve value for someone, right? We always start with what should the patient experience be like when they get cardiac rehab? And what we found is the most important part of that patient experience is your connection, your sometimes often personal connection with the coach that's helping you recover. We found that the coaches act as friend philosophers, as guides, and also really are your partner in that journey, right? And you might be wondering, you asked about an app and I'm talking about coaches. Why is that? The reason is that we view the app as a way to enhance that relationship between the patient and the coach. It's really a way for the number one, the patient to log their progress and see how they're progressing through the program and develop pride in their recovery as part of their recovery process. And the second part is that to make it super easy for them to ask their coach or get access to resources that they need to educate themselves and to improve themselves. And I think that's the value of having access to a clinically trained medical provider pretty much at your beck and call for 6 months to a year after your discharge. It cannot be understated how much that value is as part of your recovery. So I think for me, it's less about the app, but more about what the app enables as part of the care and recovery of that patient.
One of the things I find really interesting in the last little while, especially in the advent of huge focus and investment in SaaS companies, or everything is digital and artificial intelligence, is that we still err, especially in healthcare, on the side of service. Service never seems to go away as being the secret sauce, or that the key differentiating advantage is really the service piece. And so it's very interesting to see this coming up time and time again. So I'd like to spend a couple of minutes just talking about some of the people that you do serve and the advantages that they are accruing using the Move-In app. One of them has to do with the payers. So payers, as we know, is people like HMOs, ACOs, Medicaid, and many others across the globe, of people who are actually paying for healthcare costs, either hospitalizations or surgeries or medications and hundreds of other kinds of costs. Tell us a little bit about what the advantages of a payer getting involved or partnering with Moving Analytics. What are their advantages, and what are they doing to compensate patients who might be having some cardiac rehab issues or concerns?
Outside of patients, I think the actors who basically benefit the most from our solution are payers, and the reason is mainly economic, right? When a patient does rehab, their risk of getting readmitted is cut in half. A single readmission costs about $30,000 for cardiac conditions. So when you multiply that across let's say a payer with 1 million lives as an example, that translates to $2 to $3 million in savings that they would get by investing in a solution like ours. And the important thing is these are not general statistics. We've actually shown this with some of our partner payers, including Highmark Health, where we actually ran a study and showed that we were able to reduce readmissions by 50%. That is the immediate benefit. But then there's the long-term benefit of some of the other outcomes I spoke about earlier. So basically we're saying we can stop 25% of your population from getting hypertensive. We can stop 70% of your population from experiencing moderate to high depression. And that has huge billions of dollars worth of savings in improved medical experiences and so on for their members. Having said that, I think at the end of the day, it's also about member experience, right? Like our health plan, at least all the ones we work with, really care about making sure that their members have a really convenient and a world-class set of medical experiences and through their membership in the plan. And by partnering with us, they not only make virtual and convenient form of rehab available, they also subsidize the program in several ways. So for example, almost all of the partners we work with have a $0 copay for the program. So you pay nothing out of pocket to participate in this program. It's free to you. And similarly, they also, in some cases, encourage their physician groups to educate their patients about the program because they know about the benefits that the program can accrue for their members. And I think those are the kinds of things that I would encourage more payers to do if they're listening in, which is essentially, if you see a benefit really helping you economically, encourage its use among your member pool. And virtual solutions like ours, I think, are one example where one can do that as well.
Absolutely. COVID-19 has turned the world upside down. Unfortunately, it feels like we're never going to get out of this, but that's a whole other podcast. So we're in this world, and, you know, we've also heard about the Great Reset, the Great Resignation, where, you know, people are off sick, people are changing careers.
Yeah.
And this leaves employers or providers, if you will, you know, an opportunity perhaps to provide extra perks, benefits to their members, to their employees. Tell us, has COVID changed anything, the way providers are looking at this? Tell us about how this, you know, your business model has perhaps changed since COVID-19, and how providers are looking at the Move-In app.
Yeah, you know, what we've seen or observed, it seems, I was going to say last year, but really it's been the last 2 years now at this point. It's been a long journey for all of us. Because of the safety reasons and staffing shortages, in particular nursing staffing shortages in hospitals, a lot of them just couldn't offer facility-based rehab. So what used to be, you know, 16% participation rate dropped to 2-3% just because there wasn't enough, there was even less space to participate in these on-site programs. And so effectively what happened is we became the only game in town for rehab options for our patients. And that led to quite a large spike in the number of patients we could serve for going forward. I think hospitals have started realizing that, you know, they're much better at acute incidents and managing acute incidents, and anything in the life cycle post that acute incident. So any post-acute scenario, they'd rather partner with quality institutions that have the data to show that they can continue to provide a great patient experience, and work closely on integrating systems between those institutions and the hospital system. And that's sort of where we're seeing that happening. We're seeing hospitals willing to partner with us to form what I would call a hybrid or even like combination rehab 2.0 for their patient pools, where if you're, the trend is that you shift the patient to the home as quickly as possible. And so essentially, if you're low enough risk, you get the Move-In Rehab program immediately. If you're a higher risk, you do a few on-site sessions, and then you shift to the Move-In Rehab program. There's, you know, we coordinate care and exchange data appropriately to make sure the patient has a seamless experience. And so that's the trend that we're seeing. And I think it's going to accelerate because hospitals and providers in general are realizing that there are some things that are better left to other specialist organizations who can do it much better. And then they can focus on what they're good at as well. And that's a lot.
It's wonderful to hear, Harsh, about the focus on patients and the patient-centric movement, if you will, where it's very much become top of mind, and the sort of seamless experience. Tell us a little bit about what some of the challenges are for telehealth, mobile health, for the typical patient. And at the same time, what are the advantages of this? I'm thinking specifically about diversity, inclusion, underrepresented, underserviced, gender gaps, and missing data. But I'm also thinking about the newest area, which is really around decentralized clinical trials. Can you speak to the challenges as well as some of the advantages?
Sure. I think the challenges that we face with telehealth are making sure that it reaches the most rural of rural patients. And so technology penetration is, I think, an important challenge that people face. And that's where I think it's important to invest in as much infrastructure as possible, either through public investment or through private partnerships to essentially bring high bandwidth internet to the most rural of rural individuals, right? Like, because they are the ones who need it the most. And that's one thing that I see as a challenge for telehealth. I think another challenge is we all are in Zoom calls all the time. So for providers, There might be fatigue for just sitting in front of a computer. And so finding the right balance between in person and in virtual time, I think is for providers to prevent burnout is going to be another key challenge that we'll have to think through. And I think there's a space for each one of them. I think where we'll probably land is bringing people in person to establish a relationship, and then depending on a combination of safety and convenience to have virtual first and in person when more deeper tests are needed. I think that's where we'll kind of settle. I think related to burnout is really that, hey, do we have enough providers to deliver care? So I think that's where technology could play a role, where if done correctly, it could scale a provider much more by highlighting the providers, the key patients that need higher touch in a population, and those who are doing well to just give them a quick encouraging nod and then move on as part of that. So I think those are all things where we're seeing challenges in telehealth, at least from our work and our business. In terms of advantages, I think you hit the nail on the head. It's really about that access to care. At least in the cardiac field, we're seeing that basically minorities, women, non-English speaking populations have a much lower access to healthcare system for a variety of reasons. So one is obviously maybe they don't own smartphones, they don't own devices. Language barriers are an issue. There's been a historical cultural distrust of the healthcare system because of historical wrongs committed on them. All of those are preventing populations from getting the healthcare that they need. And I think where telehealth could play a huge role is in democratizing that access to care if done correctly. We're seeing that more women participate in our program than the national average because now they can balance their home life and also their work responsibilities and getting care, right? Like, so those three are now in harmony better when they don't have to travel to a facility or have to take 6 hours out of their week to participate in rehab and so on. Similar things we're seeing with Spanish-speaking populations. So when we basically, if it's the same app experience, but it's completely in Spanish, the fact that there didn't even exist an app before tells you how far we have to go in terms of to deliver that access and equity to care. So I think to build on that, I think we have to keep investing in infrastructure and also making it easy for people to get access to these devices and tools, so that, and content, more importantly, to be able to manage themselves more and be able to educate themselves more with occasional inputs from their physicians and nurses that are managing them.
Yeah, so very exciting stuff. And you've done some incredible work. You've got some great partnerships established. You just talked about the clinical study with Highmark Health. So just curious about just finishing things off, Harsh, what is the future for the Move-In app, for Moving Analytics? Where are you going? Where are you taking this? And what does the future look like?
So our mission as a company is to empower every individual to live a life free of cardiovascular disease. Move-In is our first product in post-acute care. And our goal is to take the lessons learned at Move-In and really expand the universe of cardiovascular patients we serve to include even preventative cardiovascular care, primary preventative cardiovascular care, people who are hypertensive, people who have peripheral artery disease, and so on. The model of delivery stays the same, which is you have a 3-month boot camp with a nurse or exercise physiologist who really creates a customized treatment plan for you, and then develops the treatment plan and develops it into a maintenance program for the rest of your life, right? And uses that paradigm. That paradigm can now be extended to other domains, and that's where we see a lot of our growth happening. And we feel we're very well positioned to do that just because of the evidence that we've been able to generate and the partners we've been able to work with among health plans, providers who are equally committed to increasing that access to care.
Lovely. It's very exciting to see about the sort of sustainable, N=1, very customized care plans, especially with the use of machine learning, algorithms. and eventually things like smart contracts and DAOs and all kinds of other really cool things that I'm sure you are ready to start dabbling in, being the computer scientist that you are. So there could be many, many other things that we could talk about. And I'm super excited about what your company is doing and looking forward to keeping on tabs about the much noted success. So thank you for your time. Thanks for everybody as well watching the show. If you were interested in this conversation, please take a look in the show notes. We will have Harsh's contact details if you're interested in connecting, working, partnering, or any of the above. We also encourage you to check out impetusdigital.com. These are the kinds of conversations we have all the time with physicians, payers, allied healthcare providers, patients. We bring people together in a series of asynchronous, so that means non-real time, and synchronous, meaning real-time touch points, using a whole series of interesting tools. And we get people to collaborate and work together, helping to solve issues, building tools and apps and other kinds of really interesting ideas like this, building companies and building entire new functionalities and ideas. So please come and take a look and see how we could also help with it, well, work with you and your pharma companies on these kinds of ideas. Please like and subscribe. We really appreciate. And also, if you could leave us some feedback on iTunes, we'd really, really appreciate it. Thanks everybody for their time. And Harsh, thank you so much for a really fantastic conversation today.
Thank you, everyone. And thank you so much, Natalie. I really enjoyed this conversation.